lecturer at Kisii University and director of alcohol, drugs, and substance abuse.
Okay, and right next to me.
Good evening, all. I am Rhoda Auni. I'm in charge of student career services in Kisii University. I teach in the Department of Educational Psychology in School of Education.
Mm-hmm. Okay, so thank you so much and welcome. For those ones who are engaging us on YouTube, if you have any question, any comment, you can just type it there and we'll get to read it out, or we get to answer the questions that we'll be asking. So we dive right into the discussion because we were to start at 2 and time has really gone. Dr. I'll start with you. What is this we're talking about? What is a drug?
Okay, thank you so much, Walter. And I think that's a good issue when we talk about drug use. Drug basically is a chemical substance which, when inhaled or eaten or swallowed, it affects the way one thinks, the way you behave, and the way you act. And it distorts and alters the way you are supposed to function properly. This machine, which were given by God, or by the Almighty. So basically, that is what I can be able to say, and that's a very pertinent question, so that as we get to understand the topic deeper and deeper.
Maybe in the definition of a drug, I think it takes different angles. Because when you say this is something that if you take, it alters the way you think, is a drug a bad thing?
A drug basically is not a bad thing, and that is why we must be able to distinguish between what's a drug and what's drug abuse. And drug is not prescribed by a doctor or a physician, then basically it ends up to being a drug abuse. Even if you take Panadol, even if you take alcohol, even if you take beer or wine, as long as it's not prescribed. Because even if it's wine, even if it's alcohol, there are some levels which are accepted internationally and even locally. And if you exceed that, then basically it becomes an aspect of drug abuse.
Okay.
So that's a distinction.
Now, Rhoda, maybe you can get or pick it from where Dr. Arias left, drug abuse. What could we call drug abuse?
Just like Dr. is saying, any misuse of drugs, because speaking from his definition, we all agree that any substance that changes the chemical functioning of our bodies, which may also affect the physical functioning. And so if anything is misused, if this substance is misused, like it is taken in doses not recommended, for example, even if it is a good type of drug that may necessarily be functioning in terms of maybe relieving pain, if it is undertaken or overtaken, then we can term that as drug abuse. So misuse of drug is drug abuse.
Okay, and getting it from that context, now coming to a university, how can we customize the definition of drug abuse to this kind of setting?
Now, this kind of setting now, when we talk about drug abuse, of course, you'll agree with me that even, first of all, let's begin with a good drug. I want to term this a good drug because it's a drug that is meant to help us in terms of the chemical changes to make us fit.
Yeah.
For example, if you are sick, say you have malaria, and the doctor recommends a particular portion of AL, that is good drug. But if it is underused or overused, we still call that drug abuse. And the reason why I'm talking about this good drug is that sometimes we emphasize so much on this other bad drug that could include all those chemicals that either activate or depresses the central nervous systems, and avoid talking about these other medical drugs that is very, very much abused in the university. So at this particular session, it would be also important for us to emphasize on this, because a lot of our students, even when they are given medication, they would first of all self-medicate. Somebody's feeling some pain, some migraine, they go over the counter and they buy drugs on their own. Sometimes even antibiotics. At the end of the day, when they are really now sick and they need these antibiotics, they fail to work in their systems. So at this session, we need to open up ourselves to all these drugs. And then of course, there's this other side of drug abuse, where we talk about the common drugs that are really used by students that affect them, whether we want to group them as those drugs that activate the central nervous systems, and those that depresses like alcohol, chana, and the local found blues. All these drugs, we have to talk about them openly because they are available, and there's a lot of drug abuse among our students in our colleges and universities.
Still on you, at what point do I graduate from using a drug to abusing it?
Okay, you find that sometimes as a person, you may not be able to self-assess yourself. You will not even know how you sleep from the very first time that you get exposed to drugs to the time that you now just go to a stage where it is the use stage. When you find it, you can use. If it's not there, you don't use. Like when we go for parties, say birthday parties, the seasons, like we're just from Christmas, they're just those people who are just users. But then it takes time, and after some time, you find that now people get to a little bit get used to them, and they start now slowly sinking into those stages of addiction. And by the time somebody is addicted, it is no longer a choice that I want to use drugs. Actually, I must use drugs. They use drugs for survival. So self-assessment is always the most what I'll call a wrong assessment. It would call upon us to know that there's no state that is safe. All of us could be exposed to drugs or drug abuse, but it is important for us to take caution and know that I can't wait until I can assess myself that at this particular time, I am taking now more. The intake is now more than it used to be.
And so that means that we can look at it from the drugs that are known to be abused.
Yeah.
That is like
Alcohol,
bang,
ecstasy.
yes, such kind of. And now going to the clinical medication. So you could abuse it in either way. And on the other side, if you go to a certain level of extent, then we call it abuse. So you've talked also about something that is key, that is assessment. And you said it's not easy for a person to self-assess, to get to know whether there is progress towards addiction or towards abuse, but somebody else can be able to do that. So, Charlie, coming to you. How can I physically get to know that this person is abusing drugs?
Okay, thank you. Because before I come to that, I also wanted to add my voice to the drug. We have talked about the voluntary aspect of drug abuse, but it's worth knowing that there is also the involuntary abusing of drugs.
Yeah.
Why? There are people nowadays, because of changes in the environmental degradation, changes in farming methods, changing in the way we use drugs, even to the animals. Some information and research which have been found, they have proved that people who use drugs among the animal farms, they are likely to give people that produce, and it has been discovered that basically that's what leads to resistance to diseases. Somebody medicates his or her cow today, tomorrow he's selling the milk, the market. That's why you realize there's a lot of resistance to diseases nowadays.
Okay.
And that's what I call involuntary kind of drug abuse.
Okay.
You have been abused by somebody who is using drugs, but for you are trying to do your level best.
Yeah.
I think that's where, which we may talk about later in this stage of this discussion, where policy issues need to come about. Yeah.
So now take us to the physical assessment on a person that can tell you this person is taking drugs or abusing drugs.
Okay, as we started, human being was created with the mind, the soul, and the body, where you are supposed to be holistically health, your body, your mind, and your soul. But if you begin to see changes in a person, let me take in the case of a student or a pupil, you will basically see a person even grooming. The person, the way that this person grooms, you will see some deviancy from the normal. Somebody who is not combing his hair. Mary, not combing your hair. That's a very serious kind of a thing. The way you dress, you don't care about yourself. So you spot that person around, you know something is amiss. Physically, it tells you what is inside that person. And not taking a shower. That is a sign that mentally speaking, as I said, the mind, the soul, the body, the mind, and the soul, there is a problem. There is a disconnect in that. So if you see somebody with those physical signs, there's a problem. Yes.
I know a parent is watching, and in this era, some of the things like not having your hair combed well, not dressing well, is sometimes fashion. You agree with me? Yeah. It's sometimes, it's sometimes trendy. Yeah. Sometimes it's trendy to do that, and it may not necessarily be out of drug abuse.
Yes.
So maybe other than the physical signs,
Yes.
what behavioral changes can a parent look at, so that to get to see that my son or daughter had this kind of way of doing things, but there are specific changes that point to drug abuse.
That's true. I like the way you have noted it, that not always when the physical changes is as a result of the drug abuse. That is very true. But there is a very thin line between the two components because it tells you that this person's mind has been changed and has been distorted. So having said that, I go to the physical, to the behavioral changes. A person who abuses drugs, because of the physical changes, because you don't take a shower, you are likely to lower your self-esteem and you not want to be near people. I think the audience will agree with me that. Maybe you have seen somebody outside there, you will see people trying to run away from you. So what do? Also, you will try also to self-isolate. You will be self-isolating from other people. This person, because of the changes also in the mood. Because basically what drugs also do is that they hijack your body chemistry. A person who is taking drugs, if I take it to another level, for example, the dopamine, the neurotransmitter, which works well with people, normal people, it's hijacked. But somebody who has abused drugs, for example, it's the one which is responsible for loving. If I told you love today, you will love, isn't it? But somebody who has abused drugs, his body chemistry changes. You can laugh even when people are crying. You will cry when people are laughing. And that is one of the behavioral changes. As I said, the way you act, the way you behave, isolating yourselves, and the way you relate with other people. You see people as strangers because it takes you to another level where you see some even hallucinations. You see things which people are not seeing. And ultimately, you become even mad because what they does is that they disturb your mind. When you take something which distorts your mind or your body, you get a disturbance. If you cannot manage your disturbance, you get a stress. If you cannot manage a stress, you get the mental health. If you cannot manage a mental health, you become mad. If you become mad, you are likely to die, isn't it? So basically, the behavioral changes, that's what I can observe for now.
Maybe you can dive in.
Okay, thank you. It is easy to actually notice when somebody's on drugs, and depending on the choice of drug. But general symptoms, because drugs will alter the way you behave, you can actually check out on the eyes, and most drugs would change or turn the eyes of the abuser to a little bit reddish or colored eyes. They're normally whitish. You can actually see the physical signs from their lips, depending on the use. For example, if somebody is on cigar or any drug that can be smoked, you see some burning of the lower lips and darkening a little bit of the lips. You can actually even check the hands, the fingers, especially if they are smoking or any other drug that is taken through smoke. You can always see the tips of the fingers are normally a little bit darkish than the other parts of the body. If there are drugs for example, injection, there are some drugs that are taken in by injecting to the blood veins. Sometimes you can see spottish on the skin, so it's something you can actually detect if you have somebody close to you. Depending on where they inject the drugs, you can see that they darken because of the numerous injections. You can also notice that somebody who used to be very hyper, say outgoing, say a sanguine by personality, would just easily withdraw, or they can even become over hyper. You can see some other symptoms like isolation, like Dr. says, people who want to, like parents at home, you can see a kid who is always evading you. You come to the sitting room, they dash to the bedroom. You go to their bedroom and they're feeling uncomfortable at your presence. Like always suspicious that there's something you're seeing that you're not supposed to be seeing, and very uncomfortable. It changes even diet. The people who will withdraw from food, like banks sometimes can do two things. It can make somebody really have a bigger appetite and eat so much, or sometimes it's withdraw from food at all. Even water, they don't want to go near water or something like that. It's easy to know when somebody is on depressants like alcohol, because they go sluggish, the kind of movement, the tongue sort of gets a little bit heavy, and they're speaking like they have some heaviness in the tongue. You can always see sometimes people under drugs who are shaking and sweating all the time, even in the morning or when it's very cold, then they're sweating a lot. You can notice hallucinations and even dreams that scares at night. So somebody is sleeping and they're screaming, or they are talking to themselves in their bed. Sometimes there are people who even regress. They go back to the lower developmental stages. Somebody even begins to urinate in bed even when they were they're adults. So the symptoms are wide range depending on the choice of drugs. But one thing is for clear, whether they are brothers, they are our parents, they are our family members. If you are keen enough and you know this particular person, you will notice something physically and even chemically. I remember the other time in this particular university, a student who was under drug abuse forgot about exams. Depending on the drug of choice, like this particular student, because I didn't assess to know what drug of choice, but there's some drugs that even make you lose memory. And when you're thinking today is, for example, Thursday instead of Wednesday. So this particular student came to an exam room a day after, because to them that was a Tuesday, and they insisted that I was supposed to do an exam at beginning 9 to 11, and today is Tuesday, and it was not Tuesday, only to be told that the exams had been done. And looking at him, he looked sober and things like that. But now later on we discover that because of the drug of choice, for him the days were in reverse. That's why you find that even children sometimes are defined, because somebody will be able to see a very small kid as a very big mature woman who is saying come, but a mature woman as a very small kid or an old person, and therefore drugs you cannot actually notice whether your parent or you're just in your rooms, your friends. You can notice some changes when somebody is on drug abuse.
Okay. What are some of the names that you call using drugs? Mi najua kuchoma. Ni mnajua gani? You say umse anachoma. Kuwaka. Daktari can't be knowing things that you guys don't know. Hey, come on. or the names that you call different drugs. Yeah? Shada. Shada is what? Is bangi. Uh-huh. Another one? Yes? Uh-huh. Sema kwa sauti. Vela. And which one is that? Mira. Oh, veve ama vela. Okay, uh-huh. Sorry? Ingia kwa sauti. Collabo. And which one is that? Hiyo ni gani? Okay. Oh, hiyo hali ya kupatiana. Mnafanya collab. Okay. And alcohol, what do you call it? Day. Yeah. So kama amelewa ame. Uh-huh. Another one. Yeah. Weed. Weed is bangi. Bang. Okay. Uh-huh. Na ile yenye mnaita unga. Unga is which one? Cocaine. Okay. So it's possible that as Rhoda said, that as a parent, if you're watching this, these are some of the signs you can see. Kama mtu anachoma, you can visibly get to see that in the hands. And sometimes, are you guys comfortable if your parents can check your rooms at some point to get to see? Yeah, but that is key for a parent who is having teenagers like some of you, or some who just graduated from being teenagers. Now, Daktari, how does the social placement of a person abusing drugs change? How do they affect them socially? We've talked about self-isolation as one thing, and she's explained more about how you get to evade presence of some people, and you get to build a comfort with a certain clique of people. Maybe you can talk about that for a minute or two.
Yeah. So basically, you are talking about the social challenges. You know, that's a good question because we understand that we are a depressed nation in most cases, and because of drug abuse. Somebody said that we are a depressed nation which is hiding behind jokes, behind memes and alcohol. So when you see somebody, Rhoda talked about science. We are a nation depressed. You know, somebody who is depressed and really sinking down. And when you see somebody hiding under memes, under jokes, and alcohol, that's a very serious sign that that person is onto something very serious. It could be drugs, it could be some other social challenges. But
talking of that, Daktari, we have meme lots, eh?
Yeah.
Who do what? Theirs is to go hunt and, yeah, it's important to get to understand that, because now students or other people are calling themselves memelots. Actually, I did know on my site that that could be a sign of either depression or drug abuse. But you'll find somebody in their WhatsApp status, they have almost 100 posts of jokes, of just fun stuff. But basically, that could be a sign of something.
That's a sign of something, and that's why I said it could be a sign of drugs. Because as we observed when we started the session, is that we were created to be socially good people. We are able to interact very well, we are able to make friends, and we are able to interact and be fruitful people. But when you realize, even when somebody talks, it tells you something deeper in that person. You have seen examples which are awash in the social media, where somebody even dropped a suicide note and said, I'm taking drug, I am committing suicide because there is nothing which I'm waiting for right now. Because this person started by using drugs, and he or she reached a point of no return. So this person started even posting. There are some suicide cases where somebody even does a very simple post, but at the end of the day, you realize that person has committed suicide. Because even the way this person thinks, even the way this person makes judgment, decision making is a very serious thing. Because that one, your question now takes me to the question of the behavioral even science. A drug abuser is a very serial liar. There is nothing which a drug abuser will tell you which is true. These are people who are very nervous. Those are the behavioral science, which even a parent, guardian, or a caregiver, or even we students, you students can be able to judge among your colleagues. Somebody who is very irritable, somebody, you trigger him. Even if you tell this person, good afternoon, you can't see this afternoon. So this is somebody who is under very serious influence. And when you talk about social, those are some of the social challenges and the social setbacks which this person gets, because his way of thinking, his way of making judgment is very poor. Because a sound person, you are supposed to be very stable, you are supposed to interact well. Hata kama mtu akikwambia you are a fool, are you a fool? You are not a fool. That is somebody who is very stable. But somebody whose mind has been distorted, even making friends and on a social setting, is a very serious problem. Yeah.
And also you could be able to see change of company.
Yes.
Yeah.
A change of company now comes in because a drug abuser, drug abuse is not a social thing, isn't it?
Yeah.
Is a drug abuse accepted even in the government? The question is no. So this person, the social company, this person will try to hide and try to deal with people or make friends who are of the same caliber or of the same feather, and try to hide from people, try to run away, because if you are taking drugs like the good science she has given, you are, this person is smelling, this person is grooming, because if you are not grooming well, people run away. If your behavior is bad, you are irritable very fast, people also run away from you. So that's why even the social company is very bad. So I'm going to revenge. That's why you see a lot of rape cases among places. There's a very serious case, like you see nowadays, there's a lot of violence among secondary schools, where boys, Form 3 boys, were heading and planning to rape a teacher. And when they were trying to diagnose and know what is the root cause of this problem, they realized that the boys were drug abusers. A drug abuser will not be able to make sound judgment. That's what I can say. Thank you.
Does it escalate to a point where, Dr. you can join us here? Good. So does it escalate to a point where, yes, you isolate yourself from a company,
yes,
and you choose a different one? Now you reach a point where you completely hate people who don't, you can go for that, who don't subscribe to what you're doing. Like now we are seeing cases where young people are killing their parents completely because they feel that the parents are not supportive enough to what they do.
Yeah. Okay, let's just begin with the social space in campus. You see, the moment somebody gets to a stage where now they get to be using drugs as like frequently, they'll definitely want to get their company. And so they'll shy away from the normal friends or any other friend, any other person that is not doing what they're doing.
Yeah.
And so it's very easy to find a student in campus, even with friends who are old, if they can only be united at a particular changaden, and this particular person or this particular student can run away from their age just to be in company of these old men, as long as they are always friends at this particular changaden. But then now, what now begins to happen is that, just like Tari said, they have to look for means to keep their habit or to maintain their habit. And so maintaining habits for a student at the university who is being sponsored either by a guardian or depending on Higher Education Laws Board or any other limited source, may want to now get some other sources to be able to sustain the behavior. This is where lies come in and con manship or con womanship comes in, because after they are done with selling their own property to maintain the behavior, they may also get these other friends into the deal. Like, can you give me some 1,000 shillings, I'll pay you back. They get into all sorts of betting to try and get some money and keep their behavior. And by that time, as they're using one lie to cover another lie just to maintain their behavior, definitely they're breaking their social ties.
Yeah.
These are the same people who don't want to go home over the holidays. They don't want to visit parents or relatives, because first thing first, the relationship will be spoiled by the very, very conmanship or conwomanship, and then maybe even stealing just to maintain the behavior. So drugs definitely spoil the social space of an individual. Then let's talk about high schoolers. Look at what is happening. Most of some of the students that are involved in the fire breakouts, not all, because there could be many other reasons that could lead to that. You could find that for those that are identified as drug abusers, you will find that, think about it, how comes nobody gets to notice until a school is on fire? This is because there's the isolation. Somebody gets to isolate themselves, first of all, from the entire friendship of the entire class, because then that is the only way they can operate as solo, because if this is known, then it's going to spoil the entire thing. So even at school level, and parents need to watch out for them when they are on holidays, because they will change their social spacing. You need to know who are who are friends to your child, for example.
Yeah.
Did they change all of a sudden? Are they of the same age? Do they have the same vision and goal in life? Because you can find somebody who's in Form 3, but is befriending some people who are not even school goers or dropouts, or people who are much, much older than them. So there's a way that drug abusers have their social spaces interfered with, and it's normally for the negative reasons. Thank you.
Thank you. Let me introduce our third panelist, Daktari. You can introduce yourself.
Good afternoon. My name is Dr. Jacqueline Wambukanyanga. I'm the medical officer of the institute, and I'm glad to be here as we discuss matters to do with alcohol and drug abuse among the generation of youth, which you all included, and some of us are. Thank you.
I'll just welcome you with a question, Daktari. And just to get to know, what are some of the things that motivate a person to go into abusing drugs?
Thank you. So the big issue is all about the different factors. You can start with your own personality. We have seen in studies, I'll give a scientific view of it, and then the psychologists have given the psychological point of it. But biologically, there are personalities that are more prone to drug abuse than others. Not that if you don't have a personality of that nature, you will not be prone to, but there are people who are more prone to drug abuse scientifically. Those are the people we call that social behavior disorder people. So you find a child growing up all through life has episodes of kicking cats, kicking goats, killing animals. You know, there are those antisocial children, breaking windows. We know them. Unfortunately, some of them are not checked because personality is very dependent on nature and nurture. So family history also comes in, that you might find some of our drug abusers come from a long chain of abusers. Maybe the grandfather, the grandmother, and it all trickles down. Remember, family history can only be gotten not from the clients themselves or the victim of drug abuse, but also his family. So sometimes it takes even a whole week of talking about family dynamics, 12 to 90 days when we're trying to rehabilitate the patient, to really understand where they come from and where such issues crop up. It's highly unlikely that you'll be the first drug addict in your family or abuser. Maybe the person who's in it was abusing a different drug. Another thing what I want to emphasize is that drug abusers abuse two drugs most of the time. It's just that sometimes we choose to look at the greater evil. So you find I abuse bang and I abuse alcohol.
Yeah.
Or maybe what we see in the medical world, because we now have a crop of medical students in our midst, you abuse alcohol and opiates or prescription drugs. So normally, instead of injecting the drug on someone you're doing a cesarean section, you steal half of the vial, and then you inject yourself the opiate, you get your high, you function very well, you do your work there, and you even excel in school. But remember, the side effects can also kill you. Now let's go back to family factor, because you exist as a family. Now at the family level, we have parents, especially this generation. Our generation up here might have been more strict, but probably your parents, were not judging them, but some of us are your parents, are more receptive to drugs. Nowadays you go to houses and there's always alcohol, beverages, and even shisha and bang in homes, and it has been normalized. We have tried now to elevate, now we have drugs like lift and what have you. That's called glorified drug abuse, because that is nicotine. So we have made our homes a haven to alcohol, such that as 2-year-old right now knows that, so they are doing it as it has been normalized. While maybe as we were growing up in the 80s and the 70s, this will not be the norm. Now in the family, we have conflict issues, mother, father not agreeing, children are not agreeing, children, the parents, grandparents. Poverty is a very strong factor of drug abuse. Not that the rich don't also have their problems, they cry, but the more deprived they economically you are, the more you're prone to this. Now we go to the community, now where we exist. Supposing we lock all our borders and drugs are not available, you want to tell me the drug abusers will die? See, they'll survive somehow. So our community has made it very easy for someone to be a drug abuser. The drugs are available every corner in town. The community has normalized things like smoking of bang, such that you just smoke bang and someone's like, okay, you carry on with your days. Before shisha, you go to any club in town before shisha was banned. And I'm thankful that it was one of the things that was banned. And you always find 10 people around one bottle smoking, and you look even cool, right? You just walk into a lounge and someone tells you, those kind of things that people are being given, it has been normalized. Right? We even put flavors, vanilla, and what. We're just trying to sanitize a seed or something that is harmful to us. Another thing about the community is, what are the community norms? The community norms are, number one, are we allowed to drink openly in front of adults and parents? During our days, it would be very hard for in a party for my parents to open a bottle of beer and drink. They'll even go and hide somewhere if they were to drink away. But nowadays, when you go to in December or Easter is coming up. I know one of the things people will stock in their homes is beer. And lots of it, right? And they'll be, and even be sending the children, go and bring their beer. So as you bring one for them, there was says they take another one. And finally, with the community, we have issues of other community injustices. Here we're talking about teenage pregnancies, we're talking about crime, we're talking about issues of delinquency. You know, delinquency might not be necessarily a young person stealing, but just in this vein of sorts. Like if you're driving, I'm just from another meeting, driving all the way from the end of town to here, you find children have left school, and most of them are busy doing things on the road, idling about, and you know schools were released at 3 o'clock in Kisii, and it's almost 4, but some of them, the walking distance to their home is 10 minutes, they're still hovering in town, or doing some delinquent stuff, stealing, picking a neighbor's mango from the tree fruit. Those are what we're calling, it's a form of indiscipline. Remember, the formative years of your character will be between 5 and 15. Now, most of us, if you have a mental disorder, your family will notice that something is off about you. Whether depression, narcissism, personality disorder, something will be off those formative years. We're talking about primary or through to high school. Now, the second time you're going to notice this problem will be now when you're in your 20s. So now I'm talking as a medical officer of an institution. I worked here for 6 years. Most of people who present with mental issues and drug abuse issues, when we go back to your history, we always find that in high school or upper primary, you had an episode. It might have been of a low intensity, but it's still there. you'll find that there's people who burn school in primary, will burn schools in high school, and will come here and still restore Dr. Nyanga's stuff in case of a strike. So those people, we call them delinquents. In the olden days, delinquents would never make it to university, but there's something special about delinquents. They happen to be people with very high IQ. So in the right environment, it's like kubalisha mtu suit. But when you tackle that, they can still pray. But that delinquency is still there. Now, when you move from university and survive, get a grade and start working. You'll be the same person if you're employed in the pharmacy at the university. You will still drug, you will impregnate students, you will be a bad husband or a bad wife. So this thing, those things keep following you. Now, at the age of around 40, 30, again, you have another episode whereby your wife will go and say, this man drinks, he never comes home, he never goes to work. Then what happens? You're fired from work. Then the next thing we hear is suicide. So the lifestyle of this person, by the time you're hanging yourself, your mother at home will say, by the way, I've always known this child will be a problem. There's a day alichapa pusi ya mtu nikajua huyu mtoto hatakuwa vizuri. So what we say about the person who cries is your mother because they are the ones who know you. So we've been sanitizing you over the years. But let me tell you the truth. Drug abuse, delinquency, and social behavior, it always ends in the grave. There are no two ways about it. You might not die here in the university, but if you follow your story as a drug abuser, I don't want to quote specific examples because I can be sued. You may follow your story. If you reach 50, you're very lucky.
Okay, Dr. I want to cut you short there. That's quite interesting. And I think these are things that we can see even in our own homes, in the just social sphere that we come from. I want to go to the academic side, Dr. Ali. You talk about now the academic life and how it's affected by drug and substance abuse.
Okay, thank you, Walter. There is a very strong correlation or a relationship between drug abuse and academic life. And it's worth knowing that we say there is here on we say that there's a very strong relationship between voluntary and involuntary drug abuse.
Yeah.
And let us, as we discuss this debate, let us not think about that it is something you are in control always. There are some aspects of drug abuse where you are not in control.
Yeah.
And there are some aspects where you are in control. Talk about tipping, where somebody can do it to a drink. Somebody does abuse drugs on your behalf, isn't it? Now, there is that one where you do it consciously because of the personality, because of the social life, because of the medical condition, because of the parenting, and so forth. So, as we discussed that, and as answer that question, there is always that side which you are not in control, or all of us are not in control. For example, if somebody gave you a drug and abused you or abused that person, then there's a problem. Now, back to the question. The academic life, you could fall onto a trap where somebody, I know the case of a university somewhere.
And maybe, Dr. I cut you short so that I ask a direct question.
Yeah.
If I am biochemistry, mathematics, physics, actuarial science,
Yeah.
if I do weed, I'm so smart in class.
Yeah.
So can we say that it's a good thing to do that at that point? Can we say that if you see me all of a sudden doing so well, because I'm taking a drug that gives me more time awake, so I'm reading more, I'm understanding fast, and grades also going down, can we look at it from that point?
Okay, when somebody abuses a drug, it basically we say it changes the way you behave,
Yeah.
the way your emotions are, and the way you act. Because we said there are behavioral symptoms, there are emotional symptoms, and there are the physical symptoms. If you abuse a drug and you are not able to conceive and understand issues, then you go to a level like we said, it brings you a disturbance, it gives you a stress, it gives you a mental problem, you fall onto depression, and as Dr. Nyanga and my colleague Arot have said, it leads to death. And then it means it has broken that cycle of yours. or of succeeding in life. So there is, as I said, there is a very strong correlation or relationship between drug abuse and the academic life. Because if you abuse if you abuse a drug, you get addicted very slowly. You don't get addicted very fast. Kaboot, and you are a drug addict. You don't just come like kaboot and you go. No, it is very progressive, and you don't realize that you are slipping away. This person will begin to do away with the classes. This semester, the parent knows in the school. If it's a primary school kid, the person and is a day scholar will go do drugs outside there, request for money, and as we said, there is a difficulty in there is chronic lying. You want to request for money, you go there, the parents, you go home, you eat, and if we are not observant, we realize that the drugs have eaten to the life of this person. So there is a very strong relationship between the academic life and the drug abuse, because it will affect the physical aspect, as we said, the social aspect, where you will drop your objective of studying.
So what I wanted to come out is the misconception that there are some drugs, if I use them, I become smarter. You see?
Yes, it's
so
true.
Basically, what I've understood from what you've said is that this may happen for a short while, but the side effects will come and in a bigger way.
Yes, that is true. That is true from that element. A drug, yes, there are some which you take and they make you to be high. You have that euphoria. There are some when you take, you become silly. That's why one of the behavioral symptoms is silliness or giddiness. You become silly, you are neither, the person is neither here nor there. So you can become high. If you are lucky, and I say lucky in reports, you are high and you are able to perform. If you take bunny, you plow a whole acre of land and you are not tired, but it's short-lived because optimally, or the way you were created, you are not meant to be like that, because a drug makes you to work like a possum mill, which has got 5 liters of fuel, but which is ready to grind 100 sacks of maize. Okay. So it's a misconception, and which misconception leads to people adapting to that.
Now, because of time, I'll try to move a little bit faster. So at the point that we are in, you must have understood the whole cycle of how you get introduced into drugs, how they get to affect you. And a person who has that understanding, there is nothing you could want to do than to get out of drug abuse. Yeah? So, but it's challenging. It's never easy for me to say that from today I'm not going to do alcohol. Yeah? So how challenging does the process become, and what can you do at that point to overcome the challenges for you to become really clean and drug-free?
Thank you. I would say, and especially our dear students, one thing you need to know is that if you find yourself at whatever stage of drug abuse, never forget that there's help. There's a lot of help that you can be given, but it all begins with you, with whether you really want to get help. Many times people do not get help because they see defeat before they start to try to even seek out for help. And they also look at the society and the examples of people who have been into addiction and maybe even got some help, but they still relapse. And somebody say, this one is a permanent disease. It's a disease, yes, but not a permanent disease. All of us are able to get help. And the first step for help is accepting that you are sick and that you need to get help. Maybe students, we need to also know that sometimes we think that help is very far from us. And that is even why I believe these peer educators. So you need to know that help is not far from you. You could begin with the nearest person that is in your surroundings. Say, I need help. And as peer educators, we believe that one of the functions you're doing in the university is try to educate. Give this information in all platforms that you can be able to reach. Now, as an individual, as in the process of getting help, because when you want to get help, then you will be able to be taken through some assessment. We need to know what type of drugs you're using. Maybe you're a multi-abuser, like that is saying most of people doing drugs, you find they're using 2 or more drugs, and therefore it's not just one drug they're talking about. Somebody could be using BAM, and BAM activates the central nervous system, but then like alcohol depresses the central nervous system. So there's a way you have combined things that your body does not even understand. Actually, your normal body functioning may collapse and allow this to take place, because these are 2 things that 1 minute is supposed to really be up there, and next minute it's sluggish to every other part of the body. And so you need to be able to know that assessment is important. Don't just say, okay, my problem is this, and this is how I'm going to do it. You can be able to seek help, and from seeking help, you can be able to be taken through professional help. When it's not addiction, you may not necessarily need a rehabilitation. You can even get help from a counselor who may be able to work with you to understand you. Unless you know the triggers, what triggers you into taking drugs, unless you know the reinforcements, like after you take drugs, what is it that you achieve? Of course, there's a high, but besides the high, somebody could be taking drugs to avoid stress. There are things that you're going through and you don't want to be sober to work them out. Maybe like now we're just nearing that love period and somebody has just broken your heart. And so you say, I don't want to be sober to imagine that this particular person has run away from my life. And so this is a reinforcement. Anytime you're high there, you can sleep, you don't think, and you get sober like this and you get high again, you don't think. So as a counselor, we may really want to find out what are the reinforcements, what is it that is motivating you to take, but what are the triggers? And so once we know the triggers, reinforcement, we can be able to help you as an individual. It is an individual disease. Much as 2 of us could be abusing alcohol, we are not the same. And so treatment will not be the same for us. So let us know that don't look at how somebody is being treated and say, I have already seen how somebody is being treated, I can use the same treatment. You need to seek counseling services. If it's addiction, you find that assessment, the doctor here, the clinical psychologist, the psychiatrist can be able to recommend you for rehabilitation. Rehabilitation is a positive process, ladies and gentlemen. When you hear about rehab, I want us to demystify rehab. It's like when you are admitted in the hospital, it is because the doctor thinks you need more assessment under the doctor's eye. Otherwise, when you are treated and discharged, it's because the doctor thinks, I have treated you, you can manage this at home. So that is the same way with rehab. In rehab, we have a lot of people working there, social workers, to try and help you through, because by the time you're getting into addiction, you have no relationship because they're really bad. You have lied to people, you have fought with people that are not trusting you anymore, so you need a social worker to be able to help you through that. You may be able to get a nutritionist, because you can imagine that by the time you get to a rehab, hata kuna vitu gumi, mtu hanywi maji, anakunywa maji sijui for how long. Mtu hali mboga, you just want to eat like beef or just soup. So you need a nutritionist to help you, because your body will have to really be reestablished again. You will need a doctor to assess you, because sometimes even your internal organs, your kidneys, your lungs, your heart, imechokorwa, 1 minute in a pump, blood supply, next minute in a pump, pole. You need a doctor to be able to help you through. You will need a counselor, because this is a disease that you need to really accept and know that you are always working one step at a time to be able to get to the recovery. And you never get to fully recover. You get to a situation whereby you are drug-free, but still vulnerable. And so you need to know how to be able to put some techniques down to live your life. So there's help for all stages. For those that have just been exposed, for those that are in the process of addiction, for those that are addicted, there's help for everybody. And for me, I normally believe, because people look at the people who have relapsed and say, I can't because I will relapse. Ameenda, amerudi, amelewa. Ameenda, amerudi, amelewa. We are not the same. When you really want to seek help, and it's a personal decision, yes, people have recovered or they are on the recovery from drug abuse.
Okay, Dr. Nyanga, could you want to add something on that? And maybe talk about health effects a little bit.
Okay. I don't think there's really much to add there, but I'll talk about health effects.
Yeah.
You see, as defining a drug modifies the function of the body, so you never lose the same. And remember, abuse is using a drug which has a normal effect which is desirable and using it to achieve something that is not desirable. When you're talking about addiction and abuse, you have passed the stage of tolerance, now you're using it now more and more quantities for the same effect. So it takes a toll on all drugs. Remember, all drugs foreign substances you take to the body have to be detoxified by the liver and excreted through the kidneys. So when you overload your body with those, the first thing that goes is the liver, especially when you talk about alcohol, a depressant, and the most common drug of abuse in our setting. The changas, anything, the high spirits and what have you. Remember, there are those what we call the standard recommended quantities you should take. Why I would not recommend that is just that alcohol haina tabia. Sinasema sherehe haina hasira. Ikianza imeanza, si ndio? Leo ni kazi. So there's no I'm going to tell you to take 2 beers. Utaniambia doctor ache maneno. Before, there used to be, they say one beer for a woman and then 2 beers for a man. Because there was a theory that women are more prone to addiction than not. But with equality and everything going on, we realized that it's the same. 2 beers per person. Remember the beer quantity is what, 4.7? Yes. Yes. So that's around 8.7 per liter. Now, anytime you go past that, you're already going beyond what you do. Now we are talking about the effects of the drunkenness, the stages of drunkenness. After my 2 beers, when I go to my 3rd beer, my blood alcohol level starts to be high. Now that's when I become euphoric. I became really happy. And it lasts for a few days. So few minutes, I start dancing, my body inasimuka, my pulse rate goes high, I'm breathing faster than normal. Then the next thing, we're not talking about alcohol. With alcohol, it crashes down the system. Remember, it's absorbed at the stomach, it does not wait. So the moment you drink, within 5 minutes, the effect is already. The next stage from there on, after being euphoric, it lasts about 15 to 20 minutes. You're now going to full-blown depression. In one of the symptoms, and we are only been students, we've also tested some of these drugs we've tested. The moment you need to know that you need to stop. If in the morning you wake up and ask someone, by the way, lunch. That they just know your levels were beyond what is pharmacologically affected. Your brain was so overwhelmed, you decided to shut down. That's what we call blackouts. Now, in those blackouts, because you cannot control yourself. You need to know like that. You'll actually say you put your gene. Remember the gene we have is either 37, 40, or 42% of alcohol. So actually, it has already gone high. And remember in a party what usually happens? We put, and as we are talking, someone else so whatever you say, those 2 thoughts becomes 4, becomes 6. Before you know it, you're putting a whole bottle on your own. Then we lie to ourselves and we say, can you check? Chase up. Senior, I can see someone who young than your mother. No, very bad. During our time, we used to have that bucket for cocktails. So we'd go and get some, I cannot mention jeans because we were live, but with brands. We'd go get funny jeans, funny brands, and put them together, then put watermelon, because watermelon absorbs alcohol. I'm teaching you to be brewers. Now, let's say is so that the effect lasts longer in your stomach. So that when you eat the watermelon, it remains with the alcohol, so that you see a big budget your party. You know, some of you invite you to parties, you get drunk, then you ask for more and more and more. So if you don't want that, you make sure on a cooler so that the alcohol sits in the stomach. Those are basic logistics. Now, from there on, you now start having flashbacks. That's remembering, by the way, to number in a certain club in town. Those are days later. That means you already have some form of brain damage. Now, the lungs, inhalation. If you smoke, your leg is dead. In fact, when I see a man smoking, I really pity him because I already see issues with his lung, issues with infertility. Remember, the penile structure is mainly made of collagen, and when you smoke, for women, it goes back to our breasts, which we can deal with because we have push up that. For you, a man, if your penis becomes plastic, how are you going to help? Of what value are you as a man to a woman in bed if you cannot have a light erection because of smoke? That's why you find people who are chronic smokers tunaitanga so wamechill. So you always say them hawana mambo mingi. So they tell you me hata nitakupapasa to the whole night. My friend, not that he does not know what he does. The man has erectile dysfunction at 25 because of smoking and collagen. Same to bank smokers because of the nicotine. So please, ladies in this room, a man who smokes, as a woman, let me just tell you, my friend, anything else in this life you can achieve. The cars, the good life. The only thing that is removing you from your mother's home to his is the companionship. If he cannot be with you, don't. So please, young men, there are things you don't do. Alcohol. Let me tell you, alcohol, by the time your tummy becomes cirrhosis, your tummy becomes round and you wash your cough. Then at that point, you're not making protein. Remember, for sexual function, you need a lot of protein. So men who have taken chana over the years, in fact, those people, they are white in the same room. You go even in your homes over the holiday, you'll see those addicts of chana, they have a separate bedroom. Why? Because he comes and the woman is happy to see the husband, then the man says, "Imekata." So basically, let me tell you, alcohol drugs pull down the system. Because these are things that modify your body, so your physiology all goes down. Same thing to women. If you want to have bank smokers who are women have been shown and to be demonstrated that they are infertile. Their eggs are basically in a yolk, useless eggs, for lack of a better word. So years down the line, we do a big wedding for you. You come to the Naivasha resort, tunakuja na pesa, harusi ya 3 million. 5 years down the line, no child. Kisa na maana, you guys are weed smokers or whatever you are. So basically, it destroys any because you see something that is supposed to make you forget the problems you have today. What do you think is doing to the rest of the body? So please remember, true drug addicts. I'm talking about those people who shoot cocaine and heroin. They don't live beyond 23 years or 25 because it destroys their whole body. They're usually at a high or up to there. They say the high they feel is 1,000 organisms, sexual organisms combined into one. So you can imagine how excited they are. Remember, the only reason you take drugs is to achieve what we call dopamine high, the euphoria. Like right now, if Baba or King Asta gets here, the way you guys will be so excited, jumping. So you can imagine a life you always feel that excited when you do. What is it doing to your body? And that's what drugs do. I know someone who come and tell me, "Doc, one used to tell me, hiyo usinipeni tunaitwa drugs, nipe medication." And he used to be just, when he comes to see me, he's just in his zone. You see, you are here, he is there. But those parts never end because you live in an alternative universe. But remember, hapa tu tuko hapa tu shida hii yote ya dunia pamoja. This is the real life. Don't want an alternative universe. It goes with a lot, especially your health. So take care of your body, you only have one.
Thank you, Dr. Ari. We're wrapping up. So if you have any question, ensure you have it ready. For those also watching on YouTube, I can see a few questions are streaming in. We'll get to read them. So I want to come back to you, Dr. Ari, so that we talk about policy. Yeah, especially in institutions of higher learning. I'm sure if I walk around, I'll find a signage that says this university is a drug-free zone. Yeah. What more do we need to do than having signages in schools or in colleges or universities like this one?
Thank you. That's a good question because as we began by saying that we are a society which is hiding in jokes, hiding in alcohol and menace. And that one tells us that we need to do something, just like we're doing in academics. The first thing we need to do, and maybe which we are not doing, is that we need to add more money to this aspect of alcohol, drug, and substance abuse. I see some economies, I'm not talking particularly about Kenya, where we emphasize more on science and technology. But sometimes I also wonder, because I've got to learn from Dr. here and my colleague that many scholarship levels have gone down, so I'm also defeated. Because if we are going down and down, who is going to run these machines? That is why we need to invest more on people than machines. When we talk about science, we must first of all talk about people. That's very important. Number two, we need to talk about setting up even rehabilitation centers. But as we observed earlier on, it is not good to leave people to the level where we come from primary prevention, secondary prevention, we go to tertiary. Because it is what, from the medical aspect, they will tell you that an addict who is addicted from the early levels of his lifetime, when you are addicted when you are young, getting out is a problem. It becomes a quagmire. So why can't we also, number three, come up with rehabilitation centers? Because even the Bible says that, and the Quran says that the devils, what does it say? The devil's workshop is what?
An idle mind is the devil's
workshop.
Yeah.
So if we have recreation centers, for example, from my experience of teaching at the university, I've come to realize that the students who are very active in sports, you will always find them very active in class again. That's my experience. That is my observation I've made. You see a student doing basketball, baseball there, netball, jogging every morning. Even the brain, there is a way the brain is not clogged. So number three, I'm saying, if we could come up with recreation centers, both in the national government and county government, and even universities. That is point number three. And our moderator was observing about drugs-free zone. You know, they say, in psychology, they say garbage in, garbage out. So once you begin to be told about something over and over, your brain comes to learn that this thing is not good. There could be civic, and at that point, number four, what am I saying? We should have self-awareness, and this can be done by displays. Our media. Number five, media nowadays is awash with content or graphics, which is not user-friendly. And that's why we talk about even the Kenya Films and Classification Board. We should be able to censor very well. We should be able to censor what people see. Because you become, as I said, garbage in, garbage out. You will see memes everywhere. You will see somebody has been taken by a ship and recalled and people are putting up memes. You wonder, are we a mentally healthy society or we are a mentally distorted society? People are dying to the ferry, the boat is sinking, people are taking pictures seriously. What does it tell you? We are not sound. That's why we say we are hiding in jokes, we are hiding in drugs, we are hiding in menace. That's why we need to be so much proactive and conscious. What are we doing? And it's not a question of government only. It's not a question of parents. It's a holistic thing where parents have their part, governments have their part, churches have their part, schools have their part, so that we can have that holistic social support. But that's why, on that aspect of policy, we should come, even the Ministry of Social Sports, whichever, they should come up with very strong policies, even interior, such that if you do something today, which is not sound, you do it tomorrow, you are supposed to be a rehab case or a rehabilitation case. Yeah? Or what you call this thing where you go for probation. You go for probation because you can't put up a meme in Facebook, in WhatsApp, and the people are applauding. Or don't you think so? I think we need to clap for that.
Okay, so thank you, Dr. Ari. I want to come to you so that we can talk about prevention. Now, what prevention measures could we be having? I know we've mentioned them here and there in our discussion, but you can talk about that in about 30 seconds. Then we get to the Q&A.
In the university, at home. Okay.
The university,
Okay.
mostly.
Kisii University is a drug-free zone to begin with, and that message is clear everywhere. And I think I love it because it's a reminder. It's a reminder that this is what is expected of us. But then again, we also have peer educators who try and pass these messages to our students, and I believe that's a good thing. Same peer educators train them to be peer counselors. They can be able to help in terms of identifying students who are like in addiction. Hakuna kujificha. They just see this as a student that is going through some issues. You may not know what type of drug, but you've seen clearly. And they're here to help us be able to identify and become that particular bridge that connects these particular students with the help. We have a lot of people in the university who are willing to work with students who are struggling with drug abuse, which is very important. But there's need to do more. Like this is one good thing. We are doing reminders, awareness, information, and so the talk needs to continue. That drug abuse is a bad disease, and prevention is better than cure. If you have not, we could have all been exposed to drugs, and especially at home, in school here, wherever. But then we need just take precautions that is where to stop. Exposure is the place to stop, and not to want to expose you more, and not want to experiment with drugs, and take a personal responsibility, and also take responsibility for one another. That when I prosper alone, then I don't prosper. But when you prosper, then I prosper. And because drug is our common enemy, then I take care of you as I take care of myself. Keep the message on, rolling on. You know, we have the ability. Young people have the ability. We have social media. We have the ability to be able to reach out. As I see you, we are all representatives of different towns and villages, communities, families, and we can keep the message rolling. But for parents, let's bring this drug topic at home. Let's begin it as early as possible. Let's also take responsibility of ourselves. Like Daktari said, some of us find ourselves into drug abuse because of our genetics. Let's not normalize it, that after all in our family we do this. Let's bring the talk at home and let's say no to drugs.
Okay. Thank you so much. Up to that particular point, we want to clap for the panelists for the work they've done. Not randomly. Let's just do it well. We do 3 factorials, yeah? Okay, so we go. Okay. Now, we want to take questions. How many have questions? Let me see by show of hands. 1, 2. Just raise your hands. Yes, 1, 2, 3, 4, 5. Okay, yeah. You 6. Okay, we go with the 6 for now. And I have one from the YouTube that says, this is Sami Miare. He says that he seeks to know how a bang addict can be helped. So I should give it to you. You'll talk about it. So we start with you. Who are the comments? You can stand up, please.
My name is Dennis. My comment is about what Dad said about because we are used to memes, right?
Yeah.
And we talk about it as part of the behaviors, social behaviors we see today. Then some of us use post memes as fun, right? Like I saw a meme the other day. it was saying that I'm not per second. Right? So, there's a person who sat down and created that link. And this other pastor, say a student, say a comrade, who stepped agree on that day. So when that comrade sees that meme in the morning, then the comrade loses hope. Right? And that comrade sinks into depression. So let us accept that migrants and these memes are part of the depression that we are facing, and they are part of the drug abuse that we are facing today.
Okay. Thank you for that. We had somebody else. Yes, you.
My name is Ruben Chacha. I have a question. These people who are addicted to taking tea, for example, ikifika saa tano kawa kichwa itaanza kuuma. So nilikuwa nauliza kaa hivi, hii ni advantage ya take tea ama kaa drug abuse pia.
Okay.
How we can help that person.
Dr. Jackie, you can note that one. Yes. Yeah.
This is my question. How do you help, let's say, comrades like here at the university level, you as a department, how do you help recognize where these comrades who are really addicted, going through drug abuse addiction and they want to work out? How do you reach them? How do you help them out? So, how do you get to know them? Such thing.
Okay. Identification and help. Dr. Barongo, you can talk about that. Yes.
My name is Edward. From my question, asking is the main aim of this session is just to advise the community. Now we can have people who are from drug abuse. Now, how can we help those who are addicted?
Okay. Those who are already addicted, yeah? Yeah.
Good evening.
Good evening.
My name is Evans. My question is this about the drug abuse. We have two scenarios. A person who is taking a drug and the rest of the population are not taking the drug. How are we going to assist the situation where we have the active smoker and an inactive smoker? Sometimes we believe when we have found that the active smokers are not in danger compared to the passive smokers, those who are not taking the drug. So kindly, you can explain to us how are we going to avoid that?
Dr. Nyanga, I'll add that to you. Have I left somebody else? Okay, we can take yours too.
Thank you. I'm Lisa. I happen to come from Devon County, and most people associate mirari infertility. But then, where I come from, there is large production of mirari, and actually, where it is produced in yellow part, those people are really fertile. You get to see that actually it's running at 9 children then. So I'm asking, is this infertility connected with relationship men or is actually?
Okay. Rhoda, I'll give you that and you can go first.
Thank you.
Okay, let's calm down so that we get the responses.
I want to say that if you listened very well to Dr. Nyanga, and this came out clearly, that if the drugs are if you're able to experience what the drugs can do in terms of getting that euphoric feeling, you can imagine what it's doing to your internal parts. And one thing is for sure that maybe research needs to be done why again the South population is a little bit high, but I don't think it is so, because that is a problem. The whole part of Meru, you will even find that there's a problem in marriages. You keep seeing this all the other times on TV. Women demonstrating because they want their men back, and you know what it means when they say we want our men back. And so for us as students, I would just say that unless you really want to go that way and conduct that research, then you need to take it from the medical point of view. That at the end of the end of the day, you're not winning when it comes to consumption of miraa. But let me take the question which I was given about bang. Somebody asking, how do I get help? I don't know if Sammy is asking for himself or for a friend, but just like I said, any help, you need to seek for it. You need to believe that you need that particular help. You are sick and you need that particular help. If that particular person that Sammy is talking about could be able to seek help, you can seek help from the medical centers. They're able to guide you and connect you with practicing counselors. We have even counselors in the government hospitals who serve you for free. Forget about the other maybe professional counselors that are not in the public hospitals. But you can get help also in the university. There are counselors, we have trained counselors where you can go and get help, so that we're able to know, is this a case that you can just handle at counseling level, or do you need to go to a rehab? And that cannot be assessed when you are in the room. So Sammy, please, bang abusers are treated, they are helped, and bring that friend on board. Just begin by saying, I need help. And when you need help, then we're able to assess you and know at what point are you in terms of the drug terrain, and how do we come in to help you, so that we treat you as an individual. There's no particular formula for medication where like I have malaria and this is AL, you need to take like this. Every particular drug abuser is handled as an individual. But yes, there's treatment.
Yeah. Okay. Dr. Nyanga, can go ahead.
Thank you. I was to look at tea addiction. So tea and coffee come from a specific group of stimulants. So in this particular group, coffee is caffeine and tea is theophylline. So what theophylline does is it dilates your lungs and your issues. So you find sometimes, if you dilate your lungs, you just feel nice because more air is coming in, oxygen is good for everything. But now we're talking now about abuse of tea. You're taking too much tea. Now, tea on its own is a drug that needs to be removed in the body by excretion. Now, most of the people who take tea end up feeling thirsty. You're talking about people who are taking more than 2 cups in the morning. So most of the things they do, they get dehydrated. So what do? They take more and more tea. You find rarely that someone who takes too much tea drinks water. So what happens? You find in a day someone drinks up to a whole thermos of 6 cups of tea. So what happens with the theophylline? Apart from dilating your lungs, it causes an anxiety. Your heart rate raises, you feel more alert. So someone will be dosing, then tells you, once they take tea, it's the equivalent, it stimulates them. The same way miraa does, is the same way tea does. But the quantities might be lower than what miraa does. But that is still an addiction. An addiction is you not surviving without something. For example, you have this insistent need that if I don't take tea right now, if I'm riding from here to Nairobi, I have to stop in every town I find to buy tea. I walk around, if right now I've come here with my small thermos of tea. That is what we call addiction. You cannot live without it. So personally, I will not recommend it. It even stains your teeth, especially people who use coffee and tea. So, and then finally they have this kafani bread. I don't know, that's someone who takes tea. Don't talk about tea in your tea bags. I mean, pika chai kabisa na hiyo majani mpaka imekuwa yellow thick. The same way it stains your cup is the same way it's staining your teeth. And some of you, your teeth are stained not because of fluorosis, but because of the tea you take. So please go and examine how much tea you take. Finally, every teacup you take goes with sugar, right? Right? Simple. So and most of you take about 3 spoons here. Unakula kama kilo ngapi ya sukari kwako inatumani? Maybe a 1 or 2. You know, we're also killing ourselves. So most tea addicts I have seen in my practice end up with type 2 diabetes because of the sugar they take. Because 1 cup is never enough. Now we have this theory about men who don't drink. So what do? Like right now, if I go to a hotel, with my friends who drink, you what do I take? Which has 4 glasses of tea. So that's an alternative. Remember, at the end of the day, the high my friend will have is 2 beers, the same cup of tea. So tea is there. Now, how do you stop tea addiction? Look for alternatives. Take hot water instead of tea. So if you're taking 6 cups, reduce to 3. So morning, lunch, and dinner. In between, when you feel that's the addiction, because an addiction is a drive that forces you to even stop everything when you do it. So if you feel that addiction, take a warm glass of water. Next, look for easier ways of doing it. For example, what? Start taking cocoa. Although your bromine also is a bit addictive, but not as much. Take alternative ways. Take sorghum, take soya. Eventually, you will move away from it. Because everything about addiction is, I take more of it, I feel good, right? Yeah. Yes. Now, let me move to smokers, passive smoking. Now, passive smoking is very dangerous. Even if I open all these windows when I'm smoking and corona, it still lingers in the air for 2 to 3 hours in that room. Now, take an example of the British National Hospital System, where they've done research showing children and pregnant women who live in a household where there's a smoker. Most of these women end up giving birth to children with birth defects because of the 4,000 carbons and carcinogenic products that are in the nicotine. Now, children who are born in a home where the father is a smoker and he smokes inside the house, or he smokes, then he comes with his clothes into the house and plays with the children, are very prone to asthma. In fact, all children I have seen from smoking families where the father is a smoker, most likely usually the father in this case, most of them develop, by the time they are 2, 3 years old, when you hear immunity ya mama inaisha imezaliwa nayo breastfeed, they develop asthma. Because they are constantly being introduced to this foreign body that they are not used to. The heavy particles of nicotine. And remember, the moment you sense nicotine, it goes directly to your lungs. That's why if you smoke ban or cigarettes here, if you have a sensitive nose, the moment you walk in here, a lecturer will say, "Kuna mtu amekuta ban hapa." You can sense it. So you can imagine what you do to it. So passive smoking is, yes, as dangerous as it is to someone else. So please, don't accept a room with 2 smokes. Even if it tells you I smoke outside, I smoke with open doors, those are very bad things. But smoking is one of the surest ways to health issues. Most people have health issues with smoking. That's it, and then passive smoking is as dangerous as active smoking. So if you are a smoker, be very considerate of others. And remember, smoking is not as easy to drop as drinking. Most of people will rather stop drinking but continue smoking. Now, I just want to comment about Mira. Mira is a stimulant, and the only reason we like it is because it makes us hyper, it makes us happy, it makes us jolly. Now, what we see in marriage is probably not abuse. Remember, there are levels of addiction. There's the abuse, there's the use, there's the tolerance, then there's the abuse, where now you cannot live without it. What we see there, we just see very hardworking, what do you call it, farmers who use their products. Trust me, if they were actually abusers of Mira, they will not even have energy to go to the farm. You know, have you seen the time those products are released to go to the river? It is a business and a billion one because they are usually like in Wilson waiting to export this product to Saudi Arabia. So most of it, what you might be seeing in Maryland is just use of Mira. The true abusers of Mira are usually in jobless corners in bus stations. They don't move, that's what they do the whole day. They are teeth, then they are prone to oral cancer. A lot of cancer of the mouth. We see a lot of that in Arabic world, and we see a lot of that in India, where they actually use Mira. In fact, the Mira we make in Kenya is actually used in Arabic world. That's why they use it. So, and in Somalia. Now remember, Mira abuse has been leading to the war in Somalia. Because it has made everybody is on a different type of Mira, and there are different brands, different variants that make people more and more agitated. And that has been shown by WHO that the fact that most of that country is dependent on Mira is why the war might never go away. That and clanism. Even Kenya, we have a lot of clanism and tribalism. Then if you add a drug of abuse which is normalized, the way Mira is normalized in that country, Stamalizana. So it's very important to know at what level you are in the journey. But I'm sure there are one or two cases who are probably fully abusing those drugs. Remember, Mira addicts don't even have time to be home. They sit in the house the whole day. And you know, it's a very exhausting thing. Uchanez of you it's a lot of work. What time do you have to make money? So they sit there. What they do, most of them sell it because you don't need to move. It's not like something like sweet TV you have to buy. You have your product, you put it there on the box, and you sit. As you are eating yours, you are selling. A very, very unhealthy lifestyle. And they do it from morning to evening because the buses come around that time. So they have very dysfunctional lives if you look at the two addicts who talk about.
Actually, day and night.
Yeah, they do day and night. You only see them there in the same state.
You had a question, Dr. You can go for that as we wrap up.
Yes, the question was about how do we identify comrades who are addicted and who need help. I think the first thing is to know the signs which we have rightly articulated in our area episodes of our discussions, because as we observe, they are behavioral, and they are physical. So if we realize this person has got the behavioral symptoms, and let me know from our manual, our directorate, we talked about change in activities or hobbies, chronic dishonesty, and we talked about paranoia, silliness, or giddiness, change in behavior. If you see somebody who was behaving very jovial, and this person has changed all of a sudden, if you talk about change in personal grooming habits, and if it's grown-up person accidents, unexplained need for money, stealing, and that's where there is that question of stealing of money. There is that question of cheating, because you are able to spend, and you are not able to get that money. But it also takes efforts. It also takes, those are behavioral aspects I talked about. It also takes a lot of efforts. It is one thing to know that this person is an addict, and it's another thing to take precedence to help that person. I remember sometimes back in one of the universities, there was a student who was a very serious addict, and they was about to kill one girl whom they were competing with in that room, and the people didn't know. I know the case in another institution where the business of the addict was, because some of them become even sex maniacs. You want sex in the morning, in the evening, in the afternoon, at night. You see, it's dangerous. So after that, this gentleman was beating that girl. After that, was beating that girl, because there is some kind of satisfaction, if rather will tell you psychologically, this person gets from doing that pain and seeing that person suffering. So it takes effort, but it also takes courage to go and help that person. And so there is one thing, just as we said, like in policy, yes, you can know, but do you have the empathy and efforts to help this person. Another thing, you yourself, you can be a role model. There are some of you here or some of us, when people have a problem, they do what? They come to you and whisper to you that problem which they have. And why do people come from person X? Because a drug addict basically is in another world. Dr. Ria was talking about in an alternative world. This person is seeing, I have a problem. I need to come out of that problem or this problem. But he doesn't know or she doesn't know how to come out of that problem. So if you understand very well how this person is suffering, you need to give counselors, some of you, I see you are psychologists and counselors, you need to have very serious empathy. A drug addict doesn't want you to keep on telling this person that you are a drug addict. You need to give this person unconditional love. Unconditional. If it's a manager in the workplace, you need to have that unconditional positive regard. That love which is not attached to any string. Are we communicating?
Yeah.
But if you say, I love you because you are not smelling bunny, I love you because you like me, because psychologically most of us, we love people who are like us.
Yeah.
And we hate people who are not like us. So it takes effort and it takes a lot of courage so that you say, I am going to love this person unconditionally and I report to the authorities or I encourage him or her to come out of that. But the most important thing, and I think my colleague here mentioned about that, it is important to take care when it is primary intervention.
Before it gets worse. Huh?
Before it gets worse. It's very difficult sometimes when it goes full blown and it's tertiary, and this person is getting a problem. And let me stop there by saying we need to, as a society, are we conscious? Like I punctuate my talk by mentioning what student leader said, that you post a memo, you are very happy, somebody is suffering, then it means we as a society, we are projecting this thing to go over and over, and we think we are good, but if we are not affected, we are infected. Thank you.
Thank you so much. We want to wrap it there. I know there could be a few other reactions, but because of time, Dr. will organize so that we have this discussion again next time. You see, we plan to have it for 1 hour, but we're almost doing 2 hours. So for those of you who are watching us on YouTube, we want to thank you for being there and following the conversation together with us. Before you log out, ensure that you subscribe to that YouTube channel so that you can be able to see more of what Kisii University does. We also want to thank you for being supportive throughout, those ones who are here with us, and also taking your time to be here. It's important to know that after getting such information, you are the ambassadors who are going to be able to help identify the people that need help and refer them to where help is. And also you get to spread the information so that we prevent this from happening instead of us coming up with interventions on how to help them. So thank you so much. Until next time, bye-bye.